Hi, my name is Victoria Martinez, and today we're going to be focusing on 3 palpations and 2 special tests. For the first 3 palpations, we're going to be focusing on the sacroiliac joint, the bicep femoris tendon, and the dorsal pedal pulse. For the 2 special tests, we're going to be focusing on the valgus stress at the knee and the Homan sign. First, we're going to start off on the palpation, so we're going to focus on the sacroiliac joint, also known as the SI joint. So first, I'm going to have my patient laying prone on their stomach. And then we're going to start at their PSIS, also known, which is known as their posterior superior iliac spine. And those are going to be their dimples. So once I find my patient's PSIS, I'm going to move inferiorly down their sacral, and it's going to lead into their SI joint. I'm going to be doing the bicep femoris tendon. I'm going to instruct my patient to be laying down supine, also on their back. I'm going to instruct the patient to be flexing their knee to 90 degrees. The bicep femoris tendon is going to be on the lateral side of the knee, and it inserts at the head of the fibula. I want them to flex their knee so they can bring their heel to their buttocks, and I'm going to add resistance, and that's going to activate the bicep femoris tendon. And that is right here, as you can tell. For our last palpation today, we're going to be doing the dorsal pedal pulse. I'm not going to do my thumb with this one because the thumb does have its own pulse, so I'm going to use my index and middle finger for this. My patient is sitting down. I'm going to ask her to bring her legs over here on the table. As you can tell, she is in a relaxed position, so I'm going to ask her to extend her toes. This is going to show the extensor hallucis longus tendon and also the extensor digitorum longus tendon. The dorsal pedal pulse lies between those on the dorsal of the foot. So I'm going to palpate, and then I can find the pulse with my 2 fingers. And it is absent 12 to 15% in patients sometimes.
Hi everyone, my name is Aniela, and today we'll be doing the Valgus Stress test at the knee. We're going to start with our patient supine, and we're going to ask her to be towards the edge of the table. I'm going to stand on the lateral side of her uninvolved leg first, and my hand will be on the medial distal tibia, and my other hand will be on the lateral aspect of the knee. So when the leg's extended, we are testing for the medial restraints or the cruciate ligaments. So when we do that, we're going to apply medial force while the distal tibia is moving laterally. Then we're going to flex the leg at 25 degrees, isolating the MCL, and we're going to do it again. Positive indications include laxity of the leg, a decreased quality endpoint, and pain on the involved leg. Indications include when the leg's extended, a sprain of the medial restraints or cruciate ligaments, and when the leg is flexed at 25 degrees, it is testing for a sprain of the MCL. This test is performed bilaterally.
Hey everybody, my name is Deborah, and I'll be doing Homan sign special test. First, I'm going to have my patient laying supine with her knees fully extended. And then I'm going to passively dorsiflex her foot to make sure that her knees is full extension. And then I'm going to palpate her calf muscle. So overall, a positive test will indicate that there's pain upon point tenderness while palpating her calf, or there's pain in the calf muscle. And that's an indication of deep vein thrombophlebitis. And overall, you want to make sure that you examine bilaterally. And so there you have it. That's the end of our video. I hope you guys enjoyed.